Hi there, Alan Reece with Frank and Kraft here at the Elder Care Channel. We're talking today with Sandy Dietrich, talking about a topic that's not the most fun topic, but something that's very important, and that's the topic of hospice. Hi, Sandy, how you doing?
I'm well, Alan. Thanks for inviting me here today.
We're going to talk a little bit today about hospice. From what I understand, you actually worked in that field for quite a while.
I did. I became really not only interested, but was on a pursuit. My father died a death that shouldn't have been without hospice, and so I knew there had to be something out there that was much better. This was decades ago,
Okay.
and so I actually began working in an inpatient unit, and from there, after a while, went out into the homes as well. So I have a passion for it, and have really seen some amazing things happen through the years.
Let's start by defining what it is. What is hospice?
It's simply a team approach to offer care and support to the terminally ill.
Okay.
Um, we see that Medicare and Medicaid both have a benefit. It's called the hospice benefit.
Okay.
Now, when you elect for that benefit, you are saying that you have decided to forego any further life prolonging care.
Okay.
Um, this is something that must be ordered again by that physician, and he needs to specify that a person has 6 months or less to live. Now, do I see people living longer than that? You bet. I've seen people with given the proper medication management for pain and symptom control and having that holistic approach literally be discharged from hospice
Wow.
and become better for a while, having a much better quality of life once they've made that determination and gone through the phase of a hospice support team.
Okay. Um, so obviously, anyone who's confronted with having to choose a hospice facility is already dealing with a lot of emotional um, distress, most likely. It's very upsetting to hear that a loved one is not going to be with you in the medium-term future. Um, Practically, how does that process happen once the doctor says, listen, here's the prognosis, and someone decides, listen, I just want to be as comfortable as possible for the rest of my life. Um, how do they then, is there a specific facility the hospital sends them to? Do they choose? How does that work?
Yeah, it's tough and it's a little different with every case. First, kudos to the physician if you actually have one that is very willing up front to give you that information and say, you know, we've come to this point in the road where we need to talk more fully about where we are and where you would like to be going.
That doesn't always happen?
No, it doesn't.
Okay.
We encourage families to talk. Oftentimes, it's the actual patient who says, I really don't want to do this anymore. And it becomes that matter of does that family member hear finally that this is the wish of the patient?
Okay.
And so when that happens, then we take that step forward and begin that process of choosing where and how we're going to see this play. The provision can be for hospice wherever you are. In other words, if I am living in my own home and I have a caregiver there, then you can stay there. The hospice benefit provides for all of these folks to come into your home. There's the skilled nurse who provides medication and symptom management. She comes between 1 and as many days as she's needed a week. If you're very stable, it can be once a week or up to every day of the week. The same with the home health aide who comes out to do the bathing and assisting with all of that. She visits generally between 2 and 3 times a week, keeping in mind that none of these folks actually stay in the home.
Okay.
You have to have a caregiver in the home that continues with that care and oversees it. We have social workers on board. There are chaplains that come into the home for the spiritual realm. We have as well a total bereavement ministry that keeps in touch with folks for a year to 13 months following. They usually hang on for the anniversary of the death and offer a tremendous support to any family that are interested and need that support. Another wonderful thing about hospice is the volunteers that it has. These typically I see people that have had hospice support in their own personal life, wanting to give back. They've gone through that healing phase and now are at a place of, this was such a tremendous support to me, so I want to join this team and be able to go into these homes and sit with people and offer the caregiver that moment to run off to the grocery store or whatever they need to do. It gives them a little bit of a respite or break.
Okay. So, any sort of closing thoughts or issues you might want to share with folks who are dealing with what's obviously a very difficult issue?
It is, and I think that I want to touch base just very briefly on the different hospices,
Sure.
hospice companies that are out there. Some of these hospice companies that I'm seeing now are beginning to bring people on in the palliative phase. Palliative care is something that's offered to folks in the way of pain and symptom management who haven't come to the place of letting go completely of their curative treatment phase.
Okay.
They might be hanging on to some blood transfusions, or maybe they want to still do a little bit of radiation. And so there is a palliative care team as well. And usually we see those in hospital settings.
So palliative, what that means is just trying to address the symptoms without necessarily addressing maybe the underlying medical issue that causes the illness, instead making them more comfortable, making it a more pleasant, livable experience?
Yes, but there also is that component of curative. These folks are still in the midst of that curative phase. So they haven't elected yet for hospice. And so they're still in that place of seeking some final treatment. So that's, I think, the biggest difference between the two.
Okay.
One is you're done with the curative place and are electing to end it. And the other, with the palliative care, you're still pursuing a bit of treatment. In the past, I never saw palliative care or being able to continue with treatment, something that a hospice company would bring on and take over. But now we are. Some actually allow folks to come on, and it's nice in the sense that you begin that ability to work with the folks, have them literally assist with all aspects. And it doesn't just treat the patient. That's the other wonderful thing about hospice, is that it brings in the caregivers as well. There's treatment for them, so that if there's a family member who is really lost in the midst of this, that social worker can move in and really work with that family member to help them in the midst of this as well. So there's that is one of the things that I see that some hospice teams have a little bit of an edge over. There again are many hospice teams out there, and occasionally physicians will direct as to where they want you to end up. I would prefer that you do this specific hospice because I've worked with them before. They're in our hospital network, and that can be one of the reasons that they choose that.
Okay. Any closing thoughts?
I think that, again, this can be a very difficult time of trying to wander through our healthcare system and make decisions. And for that, I always say seek out as much help as you can, whether it's from the physician or the staff that he has, or a geriatric care manager, someone that has walked this walk before and can give you the kinds of assistance you need. Geriatric care management is available throughout the nation, and you can access that by going to the website, the National Association of professional geriatric care managers,
And I'll
and
just
there select someone.
And I just want to say, just to let you know, there is a link to the National Association of Professional Geriatric Care Managers. There's a landing page on the Elder Care channel, and we should link to that from this video in case you're wanting a little bit of help and trying to find someone to help lead you through what is a very emotionally taxing process. Sandy, thank you so much for joining us and talking about this very difficult issue. And thank you as well for joining us. Take care.